started. Welcome, everyone. I'm Annika Izagiri. I am Communications Director with the Committee to Protect Healthcare. We appreciate you being here today. We are joined by physicians across Texas who will be sharing what Ken Paxton's healthcare stances could mean for their patients if he's elected to the U.S. Senate. As a quick note, we were supposed to be joined today by Dr. Amjadi, but she is unable to make it. So she will not be joining us, but we are very pleased to be joined by Dr. Lisa Gerwitz. Um, Before we begin, I'd like to note that these physicians are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves, and please do not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Durrani.
Hello, everyone. I am Dr. Awais Durrani. I'm a board-certified emergency medicine physician in Houston, Texas. And as an emergency physician, I see every single day what happens when people cannot afford the care that they need. Of course, many of my patients are in the emergency department because they're having a true emergency like a stroke or a heart attack, but many of them are there because they didn't have the access to healthcare earlier that they needed. Too many Texans are suffering, ending up in the ERs, even dying because politicians in Washington have cut healthcare. That's why I'm deeply concerned about sending Ken Paxton to Washington. My fellow physicians and I are here today because as Attorney General for the state of Texas, Ken Paxton has made it harder to access life-saving healthcare for all Texans. We worry that if Ken Paxton makes it to the U.S. Senate, he'll do even worse. Paxton has already shown us where he stands on healthcare. He praised Congress for passing H.R. 1, that massive law that slashes federal Medicaid funding and changes the program in ways that will make it harder for millions of Americans to maintain coverage. In Texas alone, the law is projected to take healthcare away from 300,000 people. Think about that, 300,000 children, parents, seniors, people working hard but still struggling to make ends meet and get the healthcare that they deserve. When people lose Medicaid coverage, they don't stop needing healthcare. They simply have fewer places to get it. They delay preventive care, they skip medications, they wait until a manageable condition becomes an emergency and they end up in my care. I work many shifts in the ER, and I almost see these two types of patients that I'm going to tell you every single shift, some variation of them, right? One patient is the patient that comes in and unfortunately they've decompensated because they didn't get the preventive care that they needed. And we have to order a bunch of tests, CT scans, blood work, x-rays, all types of stuff. And they ask me, how much is this going to cost me? And it's just so difficult for me to answer that question because internally I know because they don't have the care that they need, the insurance that they need, Medicaid, it's going to cost them a lot. But in that moment, I have to try to convince them that we need to do these things because they are in need of that and they may die if they don't get those things. The second patient is the patient that I prescribed medication to, or maybe a colleague prescribed medication to a week ago or 2 weeks ago. They were seen in our ER for something as simple like maybe a skin infection. And then they go to the pharmacy and they can't afford that medication because healthcare is too expensive or they don't have healthcare or any type of insurance. And then they come back, and because they couldn't get that simple medication, they have sepsis, or they have a stroke, or they have a heart attack. Things that easily could have been prevented, that is obviously going to lead to a poor outcome for them, that's going to cost the system a bunch, and all if we had just done the simple steps of providing them the basic healthcare that they needed. It's not just individuals who are impacted by Medicaid cuts, it's hospitals, and entire communities. Many hospitals in rural and low-income areas rely on Medicaid funding to help keep their doors open. If they close, Texans will have to travel further and longer for the very basic care that they need. Texas already has one of the highest uninsured rates in the country. We should be doing everything we can to make healthcare more accessible and affordable, not making it harder for hundreds of thousands of Texans to stay insured. Texas deserves a senator who will fight to make healthcare more affordable and accessible, not someone who supports taking coverage away from hundreds of thousands of us. Ken Paxton is not that senator. Our patients deserve better. And now I'd like to introduce my colleague, Dr. Gerwitz, to speak.
Hello, I'm Dr. Lisa Gerwitz. I've been an OBGYN practicing in San Antonio for 31 years. As Dr. Durrani shared, Ken Paxton has supported ripping away healthcare from vulnerable Texas. Unfortunately, his record on reproductive health care is worse. He's an extreme anti-abortionist. He's repeatedly demonstrated that he knows no limits when it comes to inserting himself into decisions which should be personal medical decisions between patients and their doctors. He celebrated overturning Roe versus Wade, a dark day that my physicians and millions of other Americans will never forget. As Attorney General for our state, he's made it his mission to enforce and expand Texas's dangerous abortion restrictions. He's even petitioned the Supreme Court to halt an abortion for a woman whose life was at risk. This is the story of Katie Cox, the Texas woman whose pregnancy had been diagnosed with a fatal condition, and her doctors believed that continuing would be dangerous to her health and her future fertility. And a Texas judge had already ruled to allow her to obtain abortion care, but Ken Paxton went to court to try and stop her from getting that care. He threatened legal consequences for doctors if they provided that care. Think about what that means. A patient facing a devastating pregnancy, she and her doctors are trying to make a medical decision together, and the attorney general feels that they should have the final say. This is not how medicine is supposed to work. As physicians, we know that pregnancy does not always follow a textbook. Sometimes a wanted pregnancy results in a fetus that has a condition incompatible with life, and sometimes patients need treatment immediately. Those decisions belong with patients, their families, and their doctors, not Ken Paxton. If Paxton's elected to Senate, Texans should understand exactly what they are getting. Someone who has already demonstrated a willingness to use power of government to interfere in medical care, even when a patient's health is at risk. For me, this election is in something very basic. Do we trust patients and doctors to make medical decisions, or do we give politicians like Ken Paxton this power? As a physician, I know which answer protects patients. Now I'd like to introduce Dr. Audrey Nath to speak.
Hi, I'm Dr. Audrey Nath. I am a board certified neurologist in Houston, Texas. Like my fellow physicians on this call, I'm deeply concerned about Ken Paxton's willingness to interfere with patients' healthcare. We've seen the consequences of Texas's abortion restrictions, restrictions which Ken Paxton has gone out of his way to enforce. A ProPublica analysis of Texas hospital data found that the rate of sepsis among women hospitalized for second trimester pregnancy loss increased by more than 50% after the state's abortion ban took effect. The analysis also found that maternal deaths in Texas rose while the national maternal mortality rate was falling. Those numbers represent real women and real families. Yet Paxton continues to defend these restrictions and push for aggressive enforcement. And now he wants to take that approach to the US Senate. Ken Paxton has shown that he is more than willing to use the power of government to override medical professionals, interfere with patients' decisions, and make healthcare harder to access. That should concern every physician and every patient, regardless of how they feel about abortion. Because once politicians decide that they know better than doctors and patients, there's no guarantee that they'll stop with one area of medicine. And as Dr. Durrani pointed out, Paxton supports a federal agenda that would make it harder for Texans to get health coverage in the first place. Paxton praised the passage of H.R. 1, the law that cuts federal Medicaid funding and is projected to result in roughly 300,000 additional Texans becoming uninsured. So put these two pieces of his record together. One, he supports policies that take health coverage away from hundreds of thousands of Texans. And two, he supports policies that put politicians and prosecutors between patients and their doctors. That's a dangerous combination. As doctors, we take an oath to put our patients first. Ken Paxton has shown that he is willing to put ideology first. If he goes to the US Senate, he'll have even more power to turn that ideology into federal policy. Texans need a senator who understands that healthcare should be guided by patients, doctors, and medical evidence, not by politicians looking for their next ideological fight. Ken Paxton has shown us what he would do with that power. We should believe him. Thank you, and I'll turn it back to Annika.
Thank you so much, Dr. Nath, Dr. Gerwitz, and Dr. Durrani. We'll now open it up for questions. If you have a question for one or any or all of the physicians, there are a few ways you can ask that. You can raise your hand and I can allow you to unmute and ask your question verbally, or you're welcome to chat your question in the chat box or the Q&A, and I can help read those questions aloud. So we'll allow a few moments for folks to be able to raise their hands or type their questions. Great. Cassandra, you should be allowed to talk now.
Hi there. Yes, this is Cassandra Jaramillo. I'm a national reporter with ProPublica. I wanted to ask the emergency room physician as well as the OB-GYN what you make of the fact that given AG Paxton has such a record on abortion, that he's been relatively quiet when you think about it on exactly this issue and hasn't indicated like specifics that he has in mind for federal policy related to reproductive health.
I'll answer that. I think probably because if you look at national statistics, the majority of people actually feel abortion and should be allowed in some form, not as restricted of Texas. So I think he's trying to downplay that, and hope that people forget about what his record actually is.
Dr. Durrani, did you want to add to that? Well,
I would just say that the reality of what many patients are dealing with is not pretty, to be honest. And that includes, and it's hard to say this, but I work at a bunch of hospitals. Sometimes patients will come in and maybe they would have gone to certain type of, care, 5, 10 years ago before all of this stuff was happening. And now there is a degree of hesitancy on who's going to order a certain medication, who's going to put that in, who's going to administer the medication, because theoretically, even though you're doing what is evidence-based science, anyone could, per Texas law, say that they heard something or said something, and then you're involved in some type of situation that no one wants to be involved in. And so what is happening when it comes to patient care in quite frank terms is not pretty. And I don't think he wants that to be amplified where we're talking about that every single day.
Thank you, Dr. Durwani and Dr. Gerwitz.
thank you for the question. Terry, you should be allowed to talk now.
Hi, this is Terry Langford with Texas Tribune. This goes to any of the doctors. So far, I mean, we know Paxton's record on HR1 and the big beautiful bill, but what do you all make of his latest attempts to bring the conversation back to affordability and offer what seems to be some anemic proposals regarding tax deduction for healthcare costs and healthy living spending? What do you expect to see from a Senate candidate on healthcare affordability right now? What is it that you all would like to see? I mean, we can let's just avoid the whole Medicaid, expanding Medicaid. That's not going to happen in Texas right now. But what else could make healthcare more affordable that a Senate candidate could spearhead at this point? What would you like to see them tackle?
Sure. I would love to see a candidate advocating for single payer healthcare. That's what I would love to see. I think you kind of touched on it, Terry, with things like a tax credit for healthy living really doesn't help someone who's uninsured. It doesn't bring back the rural hospital that was closed because of the Medicaid cuts with HR1, which affects everyone in that town, by the way, regardless of what your insurance is. So I want a senator to be advocating for big, bold changes as we are all trying to function in what is a very broken system.
I agree with Dr. Nath on the single payer system. There's no way of fixing the system we currently have. I have lots of patients with insurance who I go to schedule surgeries for, and then they cancel because they can't afford their deductible. So even having insurance doesn't help, that doesn't always give you access to care. So and a tax credit, as you said, is not going to do any good. Giving you money back from the national government to go towards healthcare isn't going to make insurance cheaper. So there needs to be a way to, make it nonprofit, to fix that. And studies have shown that if we had a single payer system, you would actually pay less additional money in taxes than what you currently pay for insurance, and it would save millions of lives.
I agree with both of my colleagues on the single payer side of things. So I won't kind of focus on that. They made great points. Agree with that. That is the fix. But the other thing is that we had a broken system and we were somehow making it work. And now what's happened over the last 2 years with this attack on vaccines or, conversations around Tylenol and autism, it's led to a lot of confusion and patients showing up confused to my ER. It's led to them, not knowing what to believe and what not to believe. And so we need a leader on the state level, right? Like our senators to actually speak to science and evidence-based medicine and someone who, allows us to practice what we were trained to do, and not kind of partake in this back and forth of talking about settled science, creating confusion for patients. And then when ERs are overcrowded because of all of these cuts, me not being able to, have those 15, 20-minute conversations that these patients deserve when the waiting room is 20 deep because, maybe a rural hospital closed and all those people are now funneling to the suburbs of Houston. So someone that stands for science.
Thank you all. And thanks for that question, Terry. Anna, you should be able to ask your question now.
Yeah, hi, I'm Anna Raj with Courier, Texas. And I was wondering, you guys are talking a lot about rural hospitals closing, and that sort of thing. And I was wondering, how much responsibility do you think falls on larger hospital systems that end up having a lot of um, control in the market, and absorb those smaller hospitals versus how much responsibility for higher costs and less independent hospitals do you think falls on um, employers versus also lawmakers?
Um, Hi, Anna. Thank you for asking that. I mean, personally, I think there's a combination of all of those, that there is a problem with hospital consolidation. There is a problem with private equity taking over, and really harming patient care for the sake of profits. In addition to HR1 cutting close to $1 trillion to Medicaid, and many of these hospitals, especially rural hospitals, functioning on just razor thin margins, and not having those payments come in being detrimental to them. So I think there's some of both.
Thank you so much.
Thank you for the question, Anna. We'll allow another minute or two in case anyone has any follow-up questions. In the meantime, I wanted to mention that we've been recording this, so if you'd like a copy of the recording, you can chat me right now or email me where you email to RCP, and I can get that over to you later this afternoon. But I'm not seeing any other. Oh, Cassandra. Yeah, go ahead.
Yeah, I had one more follow-up question. Just wanting to follow up on probably now what 4 or 3.5 years ago, the Biden administration had put out this directive related to EMTALA, and AG Paxton had sued the administration at the time to stop that memo. Given that that injunction is still in place, I'm just curious if there's still any type of ripple effect from that lawsuit that Paxton decided to pursue.
That's a good question. Do any of you feel equipped to handle that? If not, maybe we could take
Well, yeah, I know from my perspective, obviously in emergency medicine, EMTALA is like first and foremost that you always stabilize and treat the patient. We always have done that, always will do that. What I have had in particular circumstances is after that patient is stabilized, after those things happen, sometimes, based on the type of case it is or whatnot, and I won't get into particulars and details, hospital legal has had to get involved because of, these things that are happening. And that's something previous to this never happened. Hospital legal gets involved for other things like end of life care and whatnot traditionally. And this is something where, ER care and whatnot, they've had to kind of get involved up front and be involved and know that, hey, if this does turn into something bigger down the road, everything was documented the way that it was supposed to and whatnot. So that's kind of my small amount of insight into that.
That's helpful. Thank you.
Thank you for that question. And Anna, another question?
Yeah, I just have one more. I was wondering, one of the issues that I'm seeing when I'm talking to people, is, everyone is gearing up to vote, but there is a little while between now and then, and we're not even sure, what will come of that election. Do you guys have any advice for patients seeking affordable care, or anything immediate that they could do, instead of just going to the polls that would be helpful, toward these things that you all are talking about?
I mean, one thing they can do besides voting, which obviously is very important, but I spend a lot of time emailing my legislatures on what I think, and they vote first based on poll on what they think their constituents want. So they need to let them know how they feel and not just talk to other people about it.
One other thing I would say, and this is not to, be a pessimist, is that a lot of the impacts of these cuts in HR1 and whatnot have still not been felt. And things are, unfortunately, unless things are reversed, probably going to get worse over the upcoming years. And so right now, the system is not working for a bunch of us, and it's frustrating. And unfortunately, that's the reality. But that reality likely will get worse unless we change leadership and actions are taken. And so I would say, keep that in mind, because as bad as it is now, it unfortunately has the potential of getting worse.
I just want to echo that, Dr. Durrani, and say yes, a lot of those cuts won't even be felt until 2028, which was done strategically. Um, and here in Harris County, there is a safety net system. There is Harris Health. I would encourage anyone struggling in Harris County to look and see what sorts of benefits that they can access at a county level. But yeah, I echo my colleagues and say that is a stopgap. It doesn't really solve the real problem, which needs to be solved on a federal level.
Thank you so much.
Thank you, Anna. Well, I'm not seeing any other questions or raised hands, so we'll go ahead and conclude today's call. Thanks so much to all of the folks from the media who took time to join today. Again, I can get you a copy of the recording of this after if you'd like. But I really want to thank our speakers, Dr. Durrani, Dr. Gurwitz, and Dr. Nath. We appreciate your time and your advocacy on behalf of your patients and all Texans. Thanks so much and have a good day, everyone.
Thank you.